I'm Dr. Priyanka from Sakhi Mind Care, and this week I'm coming to a very important question. And the question is that when to say that somebody is suffering from a psychiatric disorder or an illness. Correct? Now, mind you, there are n number of psychiatric disorders. If you open, there is a very special book that lays down criteria for various psychiatric disorders, and it's this fat book. So there is depression, anxiety, schizophrenia, bipolar, n number of them, and there are criteria to lay down to diagnose all of them. Correct? So there is no particular one rule that says that this is defines if these things are present, the person is ill or not. There are many criteria, but in general we can say that somebody suffers from a psychiatric illness when there is a definite impairment in that person's day-to-day functioning. Okay, it can be, and there are many aspects. Number one is the person is not functioning up to the mark in his day-to-day functions. It can be his activities of routine, which can be grooming, getting ready for the office, or it can be the cooking at home, anything. So usual daily activities. The other thing that suffers is at the work environment, the person doesn't perform up to the mark. He either makes mistake or he doesn't perform to the best of his potential. Okay? The person and the people around his colleagues notice a change in his performance. Okay? The third thing is the person's social life also gets disturbed. He may not socialize, or there is a particular change. Either so it's not the usual normal socialization that the person has. And if it's a student, it also affects their academic career or academic performance. Okay? Now, these are the various facets of the person's life that are disturbed, and there is a noticeable change for the worse that the person sees and as well as the people around see. And when this happens, well, it's an alarm sign. So in disorders, all these change for the worse. So the person has to seek opinion. And mind you, why should one see a psychiatrist? Because like we discussed last time, these changes can either be due to these complaints can be either due to a physical illness that has psychiatric symptoms, or it can be due to some proper frank psychiatric illness. Whatever it is, it needs attention by an expert. Okay? Now, if the disorder is very severe, there is something called lack of judgment as well. Correct? So that very much warrants that the person has to be taken to a professional right away. And by lack of judgment, I mean that the person doesn't understand what's right for him as well as to the people around. So he poses a threat to his life as well as the life of the others. So that's quite an alarm signal that one has to get sorted. Now, a very important thing that I would like to highlight here is that there is this particular phase that lies between proper health, that is mental health, and a disorder. And this phase, which we call distress, is very, very crucial. So in distress, the person may not fulfill all the criteria for that given disorder. And mind you, all the disorders have specific warning signs. It's out of the scope of this video. We will discuss it some other time. But a few warning signs will be, like we saw, that there will be some disturbance in the person's life. He will not feel, will not have that well-being which is there as usual. But at the same time, it's not as bad as how we saw in disorder. And if one doesn't seek help in this phase of distress, he can very well progress to the disordered state. So one has to seek help in the phase of distress, and therefore it's very prudent to know certain warning signs of different illnesses. Certain things that can be affected are the person's sleep, appetite, which can start having a change, and in the disordered state it happens even worse. Okay. So I hope this video helps you in order to seek help at the right time for any psychological complaint. Thank you.